Good afternoon, everyone, and welcome to the Lung Cancer Institute and our updates from our nutrition series. And as always, this is very important information for all of us. We're so grateful to have you with us today. And Katie Lauterbach will be our speaker today, our oncology clinical dietitian. And her topic is fueling your bones. At the Lung Cancer Institute, we believe that nutrition is the basis of healthy living for our patients and survivors, as well as prevention for all of us. But this topic is taking us a step further into the world of exercise, which we're very fortunate or exercise and bone health, which Katie is very familiar with. So we're very grateful to her. During her presentation, your Zoom will be muted, so we encourage you to take notes. And if you have any questions, please put them in the chat box or the Q&A box, and she'll have time at the end of the presentation to answer any of your questions. So thank you for joining us on your lunch hour, and I'd like to introduce Katie Lauterbach.
Thank you, Jan, for the introduction, as always. Happy to be speaking about bone health today. It's a topic that really applies to everyone. We all have bones. We all need to keep them healthy. And there's a lot of different things that can put us at risk for bones demineralizing, such as osteoporosis. And we'll talk about all those things that we can do to kind of help prevent that and keep our bones healthy and strong. I'm going to focus most on the nutritional components. Of course, exercise is super important, but I will keep it mostly to the nutrition to just speak mostly to my expertise. So bone mineral density is what we're talking about when we're looking at how good our bones are and how healthy our bones are. And why do we care about this? Well, because bone mineral density actually impacts our longevity. So when we think about living a high quality life well into your 70s, 80s, 90s, it really relies on your ability to live independently. It relies on your ability to balance. You need to have good proprioception. You need to have strength. All of those things are really actually important and require good muscle and bone health. And we know these things can be declining as we age. And so maintaining that healthy lifestyle, maintaining that healthy quality of life, it really requires us to keep our muscles and our bones healthy. We also know that fractures from falls are a leading cause of disability and death in older adults. We all know someone who maybe had a fall and their health just, started to decline after that. So falls can be, really dangerous, and we want to make sure that our bones are healthy enough to withstand falls. And so what impacts our bone mineral density? Why do we, and how do we optimize our health with our bone mineral density? So your bones actually go through this process of ossification or building in your early years of life. So especially as you're young, they're building, and they continue to build until you kind of hit that peak around your 20s and 30s. And we really want to focus on good, healthy nutrition when we're young. But what happens after that? What happens after that, after we build our peak bone mass, is still very important, because we can actually prevent the degree of the amount that is lost after that with some of these modifiable factors. So there's going to be a lot of factors that we can't modify. We know that, we can't control for age, we can't control for gender, we can't control for our genetics. A lot of this is also genetic. So if you have osteoporosis in your family, know that you may be a little higher at risk, and you want to make sure that you're controlling all you can to support yourself. Things that are somewhat modifiable risk factors would be pharmaceutical exposure, so certain medications that you're exposed to. diet plays a huge role because it is the building blocks for our bones. Exercise is a modifiable factor, something we can control, and exposure to toxins such as smoking and alcohol are also going to be factors we can control and modify. So another thing to note, especially with the gender differences, is that women specifically tend to have a higher decline in their bone mass, and that's after the menopause period, and that's due to the hormonal changes. And especially when we talk about this setting where some people may be going through cancer treatment or cancer survivors, they may be on medications that have to be on medications that could also impact our bone quality. And so we want to make sure that if you're on any of those medications, that we're doing everything we can to support the bone health. We know that certain drugs like the aromatase inhibitors, steroids, those all can really impact our bone health. So we'll talk a little bit about those things and ways that we can kind of combat that. So some of the modifiable factors from a nutrition standpoint, for instance, vitamin D. I think this is a hallmark known nutrient that impacts our bone health. So when we have low vitamin D in the body, we have reduced ability to absorb calcium. Calcium is another essential nutrient of the bones. And we can have bone loss from not having enough vitamin D and also calcium. Insufficient intake of calcium, it's going to play with the hormones and it's going to cause bone resorption. And we also know that the protein intake is super important. Insufficient amino acids, which are the building blocks of the bone matrix, if we don't have enough protein intake, we're going to start to see muscle mass loss, which also will lead to bone mass loss. Typically, I see people a little bit more focused on protein these days, but I'll still find people where they aren't quite getting enough protein in. So we can talk about that a little bit too. High sodium is a surprising thing to think about because we don't think about eating excess sodium causing issues with our bones, but excessive sodium intake, meaning more than 2,300 milligrams a day, is going to increase urinary calcium excretion. So we're going to lose more calcium when we consume excess sodium. High sodium sources are going to be a lot of like your processed foods. Some people will say, oh, well, I don't put table salt on things. That's okay. I don't eat a lot of salt. Table salt is actually not a large percentage of our sodium intake. The majority of sodium intake comes from our processed foods. Salt is a way to preserve food. So it's just a way to make it taste better and also preserve it. So just note that if you are having a lot of processed foods, packaged foods, pizza, tacos, lunch meat, soups, those are all high sodium foods. Just be cautious of how much you have of those or how frequently you're having those. Those could be leading to us to lose more calcium, which is a building block for our bones. Vitamin K, a lot of people are kind of picking on to this. I see a lot of people getting supplements that are vitamin D with vitamin K. So I think it's becoming more known that we need vitamin K, but if we don't have enough vitamin K, calcium can't actually bind to our bone matrix. So without enough vitamin K, it doesn't matter if we have enough calcium supplementation. We're not going to be able to build it in the bones or keep it in the bones. So vitamin K is very important. We also know that low magnesium intake can be a huge risk factor for our bone mineral density. And this is one that I don't know that we've caught on to this one enough yet. And when I say we've caught on to it, I'm just speaking to what I see out in the media, out on a lot of people like media sources for their nutrition. So I haven't seen people pick up on the magnesium for the bone health specifically yet. And this is a really big oversight. We'll go into it more later, but insufficient magnesium is going to impair vitamin D activation. Vitamin D is very important for the absorption of calcium and so forth. So it's all very interconnected. So we want to make sure that we're getting all of these nutrients. We'll talk more about them later. Other modifiable risk factors, I just have to put it out there, especially working in a cancer center. I can't emphasize enough the amount of times that I see people still exposing themselves to carcinogens or toxins is just a huge thing that we can do to change. Of course, it's not easy to make changes, but it really does put you at a disadvantage when it comes to not only cancer as a chronic disease, but also even bone health is a chronic, osteoporosis is a chronic disease. So know that, smoking the nicotine is going to decrease your osteoblast activity, bone activity. It's going to decrease estrogen. It's going to increase oxidative stress. Those who are consistently smoking are going to have a 40 to 50% higher fracture risk. And when we think about the longevity, again, falling fractures, we start to see that decline, and we're not living our optimal, end of life that way. Excessive alcohol intake. The amount of times that I feel like I have to explain that alcohol is a carcinogen is very surprising. So alcohol is a carcinogen. It is a toxin in the body, the ethanol specifically. So it doesn't matter if it's red wine, it doesn't matter if it's vodka, tequila, whatever the liquor is, the alcohol itself, the ethanol, is what is the carcinogen. So the ethanol will impair osteoblasts. It contributes to poor nutrition. We absorb less nutrients. We have increased risk of falls for a variety of different reasons. Alcohol itself, if we have too high alcohol in the blood, that can affect our proprioception and our balance. And then in addition, it's going to impair the actual bone building process. So what's the correct amount or safe amount? More and more studies in general are showing that any amount of alcohol can increase your risk of cancer and possibly even contribute to risk with bone health. But right now, the threshold that we know for a fact is more than 2 drinks a day will increase the risk of osteoporosis. So especially with the holidays coming up and the indulging coming up, still enjoy in moderation, as always. And moderation, as a reminder, would be less than 2 drinks. Another modifiable factor, pharmaceutical exposure, kind of a modifiable factor, to some extent we have to take certain medications. And it's just something to be aware of, is that especially the aromatase inhibitors that a lot of our patients could be on, it does dramatically affect our estrogen levels, which is good in terms of the purpose of what this medication is doing in terms of the cancer. However, that accelerates bone turnover, and we do see the rapid bone mineral density loss. So up to 2 to 4% of bone loss per year without intervention. So that's the key. We need to make sure we're getting, baseline DEXA scans. Our doctors are really good about ordering those for patients as needed. And then making sure that we're really monitoring the vitamin D and the calcium levels. And I would also say those other nutrients as well. So we want to make sure we're getting up magnesium, vitamin K, these other things we need to be mindful of, but especially the calcium and vitamin D is what we will see specifically prescribed. And then there might be some other therapies that your oncologist might recommend as well to help with that bone loss. But we know for a fact that we need to be more cognizant of our bone health when on that kind of medication. And same with any of the other medications that are going to affect the hormones, especially in that prostate cancer realm. So we're going to have lower testosterone, which then contributes to bone breakdown and sarcopenia. So again, baseline measurements are super important, supplementing as recommended, and then any restorative therapies that are needed or that are recommended by your oncologist. Just super important to make sure we're mindful of those nutrients. And then, of course, the steroids, I said that earlier, steroids specifically can contribute to bone loss. Sometimes, people will will want more steroids. They feel better on them. Sometimes they'll be frustrated if the doctor's not prescribing more steroids. And it's just important to remember that every medication has its side effects, and your doctors are monitoring everything so closely and making sure that you're not putting that we're balancing the pros and the cons of everything. So that's one of the cons of steroids is that we could have some bone health consequences here. So just all depends on how much, the time that you use it, and everything. It can also decrease the calcium absorption, which is part of why it's not good for bone health, but it's also affecting the actual the ability for the bones to be to maintain their structure. So baseline DEXA scan, vitamin D and calcium supplement support, and those other special nutrients to help support our bone health are super important. And then another one that's surprising, people might not know about, is that chronic antacid medication. Again, a medication that's very good to kind of help manage acid in the stomach. It could also, prevent unnecessary acid exposure to the esophagus. There's so many important reasons why we might need a PPI or an antacid medication. However, we know that this can affect the ability to absorb calcium. So we could have a higher risk of fractures if we're not being very cognizant of our calcium supplementation, vitamin D supplementation, making sure that we're getting enough of those other supportive nutrients. So just things to keep in mind. And there's other medications that can, of course, be associated with the risk of bone mineral density loss. So we talked about the steroids, we talked about antacids, chemotherapies themselves, SSRIs, so some medications that are helpful for balancing our mood or pain, that might be prescribed by a psychologist, psychiatrist. Those can also contribute to potential bone mineral density loss because it affects the absorption of certain nutrients, certain diabetes medications, anticonvulsants. So there's, always potential nutrient loss with certain medications. Something I just wanted to point out with this table, I put it in here because some people ask for the slides at the end, and this might be something good to reference. But the thing to note is that, again, certain medications, including chemotherapies, can cause us to have lower levels of certain nutrients. We can have reduced ability to absorb them. We can excrete more of them. So the cisplatin is one that's known for things like the magnesium loss, the phosphorus loss, among other things. So things to keep in mind. If you are on, again, any kind of medication, there could be some losses there. Now, when we talk about kind of the other end of the medications that are going to treat or prevent bone loss, we need to make sure that we have our calcium, vitamin D protocols in place, and protein protocols. So if anyone's ever been on any of these medications that kind of help with rebuilding the bone or help protecting the bone from being further lost, we need to make sure that we're getting enough calcium. So 1,000 to 1,200 milligrams of calcium a day. Some people will do calcium supplementation. I do like to do a food approach as well. So also like to see what we have from calcium in the diet. And we'll get into why a little bit later, but know that your needs are going to be 1,000 to 1,200 milligrams a day when you're on these therapies. Vitamin D, we want to make sure we're getting a pill form of vitamin D, whether it's closer to 800 or 2,000 IUs a day. Maybe you're on a higher amount depending on what your baseline levels are. Make sure we're getting a baseline level of what your vitamin D is in the body to see the storage form, to know how much to supplement. So that's really important. And then protein, again, is going to be key here. We do have higher needs when we're thinking about any chronic disease-related weight loss, really, but in this setting, I'm referring to cancer-related weight loss and sarcopenia. And that 1.5 to 1 or 1.2 to 1.5 grams per kilo per day, for example, because that might not mean much to you. If you're a 150-pound person, this means 80 to 100 grams of protein per day, which can be hard to get if we're skipping meals. If we're only having 2 meals a day, that can be really hard to get. if we're not having really high protein sources in our meals, we might need to consider something like a shake or supplement, or prioritizing high protein foods. So that's things to be mindful of. I wanted to also mention, in terms of, vitamin D being a really important nutrient for bone health, I did want to mention its role with some of these cancers. So just knowing that vitamin D deficiency in those with some of these blood cancers is associated with poor prognosis, higher rates of relapse, significantly longer hospitalizations. So vitamin D intake is very important, especially with some of these blood cancers. And we have a lot of good data on this with some of these other specific blood cancers that I put in the slides. I want to get more to the rest of this lecture, so I'm just going to leave this here, but it's a good reference in case anyone is wondering about that. So let's get into more of the meat of it. Let's talk about vitamin D specifically. I think this is a hallmark one that we know is really good for bone health, but let's talk a little bit more about why. So studies suggest that nearly 2/3 of Americans are vitamin D insufficient, and I see it on the blood work all the time. More likely than not, someone is going to be deficient or insufficient in their vitamin D status than have adequate levels. And it's a lot of different factors. It's not, some people think if we go out in the sun, we should be getting enough vitamin D. Not necessarily true. Not everyone can synthesize the vitamin D from our cholesterol like we were maybe once told. We have different genetic differences that might affect our ability to convert cholesterol to vitamin D. And sometimes even the color of your skin can reduce your ability to convert to vitamin D. So there's a lot of factors genetically with the sun. We can't rely on the sun. What we really find is that people will often need a supplement. Just to know for levels, anything under 30 is going to be deficient, insufficient. Optimal range is going to be 30 to 50, especially in our high-risk populations. I feel more comfortable when I see the vitamin D level closer to 40 to 50. My goal would be 50 for people because it's a good storage amount. We're not hovering over that insufficient, deficient side. And more studies are showing that keeping that vitamin D level in the body higher is more beneficial for us. Vitamin D is used in a lot of different ways in the body, not just bone health, but especially for bone health, we want to make sure it's at a good level. Low vitamin D, again, it contributes to a lot of things. So not only puts you at risk for osteoporosis, but also low levels are associated with cancer, cardiovascular disease, depression, autoimmune disorders, type 2 diabetes. So it's very important to get your vitamin D levels checked. A lot of times I'll ask people if they've gotten it checked recently in their blood work, and they'll say, oh, my doctor did blood work. I'm sure they tested it wrong. They don't always test vitamin D. This is something we have to ask for, and I always encourage people to be their own advocates. So make sure you ask for your vitamin D level to be checked when you go to your primary care doctor. It's very important. Currently, we say we need 600 to 800 international units a day. That's typically too low. The literature is showing that it's actually a higher amount we need. We just haven't really adjusted our RDAs yet. We're finding a more reasonable dose is 1,000 to 2,000 international units a day. So, and those with deficiency might even require higher, closer to 5,000 international units a day. Some people need a therapeutic prescribed dose of 50,000 international units, and that would be given weekly in over a certain period of time. So that's what we should know about vitamin D. The other reason why we see such low levels is because it's really not in our food source. So if we can't synthesize it from the sun and we're not getting it in our food source, it's really something we need to supplement. So the foods, if you're having cod liver oil daily, if you're having trout, salmon, again, daily, then you might be okay. But otherwise, a fortified milk, fortified plant-based milks are going to be a source. ready to eat cereal, that's it. So it's really not in our food supply. So most people need a supplement. And I just listed some supplements here so that way people could kind of, just see some third-party certified examples of supplements. So when I say third-party certified, that means it's gone through purity and potency testing, meaning that they test for any, junk or added stuff that might be in there that we don't want. And it makes sure that what they say is in there is actually in there. So that would be the USP seal or the NSF seal. And these are all examples of products that have that. Other nutrients that we think of with bone health, it's not as simple as the vitamin D. You get a blood test, you can see what your level is, and you can correct it with a supplement. The other nutrients get a little harder. There's not really typical lab testing for these nutrients, especially things like the calcium, the magnesium. We don't want to look at blood levels for storage or intake purposes. If your calcium or magnesium is off in your blood, that's more, there's something else going on that's contributing to that. It's not reflective of intake per se. So calcium is very tightly controlled in the body. It has really tight homeostatic control, the parathyroid hormone, calcitriol, calcitonin. So there's a lot of hormonal balance that's keeping the calcium at a certain level. 99% of our calcium is stored in the bones and the teeth. So doing actually a bone mineral density scan, the DEXA, for example, or a dietary intake assessment would really be the way to assess our calcium status and our calcium levels. Blood should always be in range for the most part. So blood is not an accurate reflection of intake, because if we're not eating enough calcium, what the body will do is it will pull from your bones to make sure the blood stays level. It's kind of like sugar, where your body always wants to have a certain amount in there for survival. And so if we don't have enough calcium coming in, we're just going to keep grabbing from our bones to keep it at a certain level. And eventually our bones could become osteopenic. So we know that we can't test it with blood. Magnesium also similarly tightly controlled, 99% stored in the bone and muscle. So we really need to assess our dietary intake and or clinical signs to determine if somebody's inadequate in their magnesium. Vitamin K as well, it's typically assessed by looking at the diet. There's not a lot of good biochemical markers. There's some, but typically people will get enough vitamin K if they're having a balanced diet. So just other things to note, since I harped on the vitamin D testing, it's not as simple for the other nutrients. And then I just also I thought this was a nice, very simple way. Sometimes I overcomplicate things. This was a nice, simple way to look at how all these nutrients are interacting. So vitamin D is very important because it's pulling the calcium in from the digestive tract. It's helping with the absorption. Once we get the calcium in the blood, we want it to go to our bones. So we don't want it to go and get stored in our arteries and our heart. We want the calcium to go to our bones. Vitamin K is helping direct that calcium into our bones. So that's why we see a lot of supplements that will be, vitamin D with K and maybe even calcium in there as well, or the calcium will be separate, but we want all those working together. And the only one that's not mentioned here is magnesium, which is also very important, kind of acts like vitamin K, where it's also redirecting to the bones versus the arteries and the heart. So calcium intake. Calcium intake is super important. There's a lot of diet sources, so I really do encourage people try to get their calcium intake from food. Sometimes people will feel that dairy might be bad. Some people have an intolerance to dairy. Not everyone can tolerate it. But if you don't have an intolerance, there's actually nothing wrong with dairy. It's a nutrient-rich source of calcium. So I encourage people to make sure you do get some, Greek yogurt, some cheese, cottage cheese, milks, or even plant-based milks are going to have a good amount of calcium in them. A lot of them are fortified. When looking at leafy greens are a really good source of calcium when they're cooked. So the way to absorb the calcium from the leafy greens is by cooking it. It helps it's bound in by some oxalates, and so when you cook it, it helps break up the oxalates, and you can absorb that calcium better. So make sure you do both raw and cooked greens. They're both very rich in nutrients. The thing to note about calcium is that if you're supplementing with calcium, especially if you're supplementing with calcium, we want to make sure you're getting enough magnesium and vitamin K. But especially with magnesium, this ratio, this 2-to-1, 3-to-1 ratio of calcium to magnesium is very important. There's, mixed literature out there about calcium supplements and the risk of cardiovascular disease. This specific meta-analysis found that calcium supplements actually increase the risk of cardiovascular disease in 15% of the healthy postmenopausal women population. And if think about it, if we're supplementing with a lot of calcium in the purpose of helping our bones, but we don't, again, have the right nutrients to direct it to the bones, it could be stored in the arteries, and that could cause some blockages and some issues. And so what we want to do is make sure we have all the nutrients we need to direct it to the right places. So sometimes people will get a supplement that has both calcium and magnesium in it. Some people will choose to really focus on their food intake and make sure that they're getting all their calcium needs from foods. It's hard. We got to really focus on it, especially if you are higher risk of osteoporosis, or you're on some of these medications that puts you at a higher risk. You may still need to do a supplement just to make sure you get enough. But let's make sure there's magnesium intake as well. The reason why it's a little bit better from food is because food will also have these other nutrients with it. Food is amazing. It kind of knows exactly what we need in our body. So it's a lot of food sources that have calcium also have magnesium. But we also might need that supplement support. So it's something important to note that we need all of them to help direct it to the right places in our body. I just listed this supplement here because I thought this was a good example of that 3-to-1 ratio for the calcium to magnesium. So what you might notice when you go to look for a supplement, you might see these kind of, they're marketed for bone support. So you might see advanced bone support, osteo something support, instead of just a calcium supplement. And these are kind of nice. Make sure that they have the 3-to-1 or 2-to-1 ratio. So here we're getting both the calcium and the magnesium, and then they also threw the vitamin D in there too. So this is a nice example. And going to magnesium intake, a lot of people don't get enough magnesium in the diet, and that's just because a lot of us won't eat enough of these high quality foods. I'm a huge fan of getting magnesium from the diet versus a supplement, because magnesium-rich foods are also really high fiber foods. A lot of Americans don't get enough fiber either in their diet. And so if we can get higher magnesium, higher fiber foods in the diet, we're kind of killing two birds with one stone, so to speak. Your overall quality of diet will be higher. Your phytonutrient intake will be higher, because these are a lot of wonderful plant-based foods. So for instance, you'll see one of the highest ones is pumpkin seeds. I'm a huge fan of pumpkin seeds and chia seeds. I'm always telling people to put seeds in things. And if you can tolerate it, I know some people might have concerns with things like some diverticulosis. They don't want to flare up. Understandable. We can always grind these things and make them a little bit smoother, softer. You can have the nut butter versions of these things. But just note that seeds are a particularly good source. Spinach, again, cooked, is going to help us absorb those minerals, right? Again, nuts and seeds, some fortified cereals and milk products, and then beans. Beans are another really good source of it as well. And we can also sometimes benefit from a supplement. What you'll notice is a lot of the supplements won't contain the full 300 to 400 amount that we need per day. And that's because we can be getting it from food. We also don't want to overdose on magnesium. They'll give it usually in 100 to 200 milligram amounts in supplements. Sometimes you'll see like a 500 or something, but I think a 100 to 200 around that is really reasonable to add in addition to your food sources. Um, so that's something to note. When talking about magnesium supplementation, there's a lot of different kinds. So the magnesium citrate is a really nice, highly bioavailable, and it's one of the best for our bones. However, if you have a sensitive GI tract, magnesium citrate will have more of a laxative effect, just so you know. So if you do take magnesium citrate and you have, normally looser stools, that is going to potentially be a problem for you. So the magnesium supplement that I will recommend for both high bioavailability and good for your bones and won't give you that laxative effect is the magnesium glycinate, or you'll also see biglycinate as well listed as an option. It's, again, absorbable and it won't give you that laxative effect. Some people want it, so you have the option of citrate as well if you want it. And I just listed, again, third-party certified supplements below, just as examples. In vitamin K intake, we talked about this as being another super important nutrient that, again, is going to help direct that calcium to our bones and away from our arteries. And something to note is that there's some pretty good food sources available. So the collard greens, turnip greens, spinach, kale, broccoli, leafy green foods are a bone health food, really, if you've kind of noticed with all the nutrients in this lecture. So we see a little bit of some beans as well, some pumpkin, pomegranate juice, pine nuts, blueberries. So vitamin K, we typically aren't deficient in the diet if we're eating like a well-rounded diet. But it's just a reminder to get those leafy greens in so that way we can get enough vitamin K. You'll also see it, like I said, a lot of supplements will do vitamin D with vitamin K now. So that's nice that they already kind of give us that support. I also wanted to bring up, in addition to all of the important nutrients that we know for a fact we need for bone health, there are a lot of other supplements on the market that people might be interested in or might hear that are helpful for bone health. These ones are not ones that I would say like, oh, if you have a risk of osteoporosis, go right towards these supplements. It's more get your basics with nutrition and exercise done first, and then look towards maybe some of these other supplements if you're interested. So there's been some studies on creatine and muscle and bone health as we age. And we do, so far, there's a lot of, it's still in the beginning stages of figuring out bone health with creatine. However, what certain studies are saying is that we do see some increases with muscle mass and strength in older adults who are using creatine supplementation. We also see a little bit of influence on bone metabolism, and that could be something that helps us support our bones. It's not the first place I would go, but just know that there is some research that does point towards it being potentially beneficial. So I think that's worth noting. Another supplement that I think is worth noting for bone health is collagen. So we know for a fact that collagen is very helpful with osteoarthritis. We know it can be helpful with ligament injuries. We know it can be helpful for athletes in recovering, healing. And now we have some research that also says that collagen can also be helpful with bone mineral density. So in this specific meta-analysis, it looked at studies and it found that when people supplemented with collagen peptides, they had significantly increased bone mineral density, especially in their femoral neck and spine. So in those bones, they looked at the density in those bones specifically. And then collagen peptide supplementation, they did in about 5 grams per day. So the thing to note is that, for instance, athletes will use 10 to 15 grams of collagen peptides, but they're finding for bone health, you can actually use a little bit less. So they're finding 5 grams a day. just very interesting. And just know that your supplement, all the supplements can have different varying amounts. So I always like to see what the amount was that they studied, because that's the amount that we would probably want to use for this specific goal. So interesting things to know. We're still learning more. And then, of course, we can't possibly talk about bone health and keeping our bones healthy without talking about exercise. It's a very important part. So weight bearing, resistance training exercises are absolutely essential to nutrition protocols. I just popped some in here to show how simple it can be. It could be, weightless squats. It could be just jumping up and down pogo sticks. It could be forward lunge, step ups. It's anything that's weight bearing is going to be beneficial. Resistance training with bands and weights is also very beneficial. It's anything that puts a little bit of stress on the bones, but not so much stress that we're injuring ourselves. But it's anything that puts the stress on the bones. And it's important to know. A lot of people will tell me, "Oh, I go for walks, or I move around and go move around the house, move around the garden." All that's amazing, and it's not sufficient to prevent bone loss. So walking alone is not enough to prevent bone loss. We really need to be doing, again, that weight bearing exercise and or resistance training exercises, because that's going to be what ultimately reinforces those bones to stay strong. Okay, so that is all of that in a nutshell. I've talked so much. I'm sure some people might have some questions, so I always like to be mindful of leaving a little bit of time for that. I think someone raised their hand at some point, so yeah, happy to take any questions. I do see someone else just raised their hand. If you could type your question in the chat box, that would be amazing. I see someone has their hand raised, but we can't take you off mute, so please go ahead and type it in the chat box. Oh,
No, that was me.
and now I see you too.
Yeah, looking to see who it was. I don't see anything in the chat box or the Q&A. I think I can speak for all of us when I say I would like to have you on speed dial. And just there's so much information that, as always, as Katie does so much research to put all this together, and it's information that we don't know, and you just deliver it to us. Oh, you got it. Thank you. Yeah, you deliver it to us in such a way that we can understand. And I think, like you said, a lot of people will love to get these slides because there was actually shopping lists there along with all your education, which is really helpful for all of us. So we want to, first of all, thank Katie. Oh, okay, here's a question for you. Can you see it, Katie?
Yes. Okay, after years of taking Fosamax, and after you've done this, it's only drugs that keep it stable, but when you stop, you're back to osteoporosis. So I think just speaking to the fact that some of these medications really do deplete some of our stores of these nutrients, and then it's amazing because these medications help us, but then once you're stable and once they're helping you, you have other issues. So it is just a story of pharmaceuticals. There's always side effects. They're amazing tools that help keep us alive. And we also need to make sure nutritionally that we're balancing it. So yeah, hopefully this lecture helped guide you for managing the osteoporosis.
Any other questions?
Sure.
Well, just so everyone knows, our lectures are always recorded. And so this is such great information. If you want to look at it again or share it with family or friends who you think would find this beneficial, and I'm sure that would be everybody. Yeah, you're getting lots of thank yous. Lee will be sending an evaluation. So we really appreciate you completing the evaluation and returning it back to to Lee. And at that time, you can request a copy of the lecture. It should be edited and ready probably by the end of this week. And in December, we're only going to have one lecture, and that will be from our nutrition series and with Katie again. So thank you, Katie. We know that this is, you're excellent at it, and obviously you love educating us, but we also appreciate how much you put into it. So we're very grateful to you. And thank you to everyone for spending your lunch hour with us. And a lot of good information today. Makes me hungry. So go enjoy lunch. Thank you, Katie. Everyone have a great afternoon.
Thank you, everyone. Bye.
Bye.